Welcome to Writing and Submitting the Right Abstract, a module in the series of training topics in support of the Increasing Clinical Effectiveness Initiative. Already in this series, we have from 2014 the ICE training overview. We're now calling Setting the Stage. If you haven't seen that yet, you should probably review it because it does cover the background of why we have this ICE initiative. But in this 2015 series, we will have a unit on selecting the right problem, selecting the right intervention and measures, selecting the right methodology, collecting and analyzing the right data, and this topic, writing and submitting the right abstract. To review, at this stage, you should have already selected the problem, you've already selected the intervention, you've already selected your measures, you've created your problem statement using potentially the PICO method, and you've created your methodology, implemented it, and collected the data and done your analysis. Now you're getting to the point where you want to actually submit this into the ICE program for consideration because you want to share what you've learned and also potentially have an opportunity to present it orally at any of the several venues that we have set up for this ICE initiative. The 5 components of what you will submit online are the session title, the problem and background, the intervention study plan and measures, data analysis and results, and discussion and lessons learned. What we're going to do today is sort of give you the scoring sheet, the cheat sheet of how your abstract will be evaluated. And so using this, you should be able to submit something that will be scored very high. Let's start out with the problem and background. I'm going to assume you have a reasonable title. You're not actually being scored on the title, but the title is important in terms of being able to classify it and think about it. But in the problem background, this is what our reviewers will see. They actually will be asked 3 questions. Does the problem statement explicitly identify the goal? In other words, the benefit to be improved or the harm to be reduced. And they will either give it a 0 points, or 1 point if they feel that you've partially done that, or if they feel the answer is yes, you'll get 2 points. Is there sufficient context and background about the problem, including the stakeholders involved? Again, you can have a 0 to 3 points. Now you can see it's worth a little bit more. We want to make sure that the lab is integrated into the health system and working with non-laboratorians. And so knowing who else is being involved in the project is important to state that. And does the problem describe the importance of solving the problem, the priority? Why was this problem chosen? Was it easy or was it important? We're hoping it will be important. And again, you can see the point totals that will be awarded based on the reviewer's assessment. By the way, there will be multiple reviewers of each submitted abstract. We commit to a minimum of 2. It could be as many as 5 reviewers, depending on how many total abstracts are submitted. The reviewers who are posted on our website, so you know who they are, but they are an international group of laboratory leaders that bring a very diverse set of backgrounds to the evaluation process. Let's move to the next category. This will be an open text area where you'll be able to, again, put in free text that describes these, the answers to these questions. So is the description of the intervention to be used and the reason for its selection clear and complete? Obviously, these are not going to be 2-paragraph answers. They have to be short, but you have to explain, like we did in the PICO naming process that we talked about in the previous module. You have to talk about that intervention and why it was selected and be clear that there's a causation factor involved. You have to let us know whether the study plan is well described. You used 500 randomly selected emergency room visits. Did you divide them in half with 250 getting the intervention and 250 not getting the intervention? It could be simple, but it has to be well described. Is the setting clearly and appropriately defined? Are these emergency room patients, all hospital inpatients in the ICU, primary care office visits in a pediatrician's office? So tell us something about the setting. And is the patient population clearly and completely described? Now, if gender is not an issue, you wouldn't mention it. But if it's anyone coming to the office, the next 500 patients coming to an office, regardless of gender, age, minority status, you would word it just as I said. But if you are excluding or including certain populations based on gender, age, minority status, insurance status, or whatever, then you really need to say that you're doing that. Furthermore, in the intervention study plan measures section, you need to talk about the utilized measures, and the judgment is, are they appropriate? And so there'll be a total of 10 points. This is huge because we're looking for measures of direct patient outcomes. So some of the smaller points are the utilized measures well defined? And are the measures appropriate for the problem and the intervention? Measuring something that has no linkage to the intervention, or whether it's an unintended consequence or a direct causative factor, but measuring something that's inappropriate, there's no points for that. That third bullet point, you can see, are the measures linked to patient outcomes? 0 to 6 points, that's big. And on the next page, we're going to talk about how that will be assessed, allocated. And the last one for this page is the data collection process adequate for the problem? So by that we're talking about, did you collect 500 patients? Did you collect for 2 weeks, for 6 months? Was it every patient that went through the process? Or was it every third patient or something like that? So was the data collection process adequate? Were you getting the data from an appropriate source, et cetera? Now, I said there were up to 6 points possible for the linkage to patient outcomes. And so there are 4 categories there. If your outcome measure is a direct measure of patient outcome, you'll be awarded 5 or 6 points. Examples of that might be time to diagnosis, morbidity or mortality, patient satisfaction. Reduced seizures, I use that example, and the next one, fewer adverse events, for example, sepsis, for very particular reasons, as you'll see down below. A strong linkage to direct patient outcomes might be things like reduced transfusions or antibiotics. We know using antibiotics can have unintended consequences. And so it may impact the patient's status, in which case it has a strong linkage, but it isn't necessarily the status itself. Same with things like reduced readmissions or length of stay. A moderate linkage to direct patient outcomes could include things like reduced rate of recollects, which will extend the patient's inconvenience or increase their inconvenience or extend the time until they get results to some degree, but it doesn't necessarily ensure that the patient has actually changed their health status. Time out of therapeutic range is a weaker way of the example I used in the first bullet point, reduced seizures. So if you're just measuring time out of therapeutic range, or if you're measuring the population and you're looking at the percent of people on anticonvulsants who have not been measured for their therapeutic level, or if you're measuring the percent of patients who have been measured but are out of their therapeutic range, that's one thing. But if you're actually measuring the number of them that show up in the emergency room with seizures, that's a direct patient measure. And then finally, the weak linkage to direct patient outcome, for which you would get 0 points and probably be excluded from the ICE initiative and have your submission transferred to a different abstract process, but not ICE. But if it's a very weak linkage, if you're just reducing defects that come into the lab, but you haven't included any data on how it impacts the patient, then it's going to get 0 points. Data analysis and results. It's clear, again, 0, 1, 1, 2, yes. You can see the various points up and down the page, but is the source of the data specified? Is the time span in which data is collected both described and sufficient? The full total volume of data meaningful? Is there a good comparator, a baseline or a control from which you're assessing the improvement? Is the statistical treatment appropriate? Is there evidence that other causes were considered that would explain the data in the different hypotheses? And finally, were appropriate additional measures included that would detect unfavorable results from the intervention? So did you think about that? With all of these things, again, the question is just making sure you've thought about it ahead of time and have described it quickly in just a couple sentences how you are dealing with all these various issues. And then the final category is discussion and lessons learned. Was there adequate consideration of other factors? What are the limitations of your study? Were the conclusions described in their applicability to other similar institutions? And was there discussion of what has changed in the institution as a result of the work? In other words, we want to know whether or not this had impact in your institution. Did it change anything? If you did great work, caught lots of data, and nothing changed because no one else bought into it, it's not a lot of points, but that's an important factor that we need to include with everything else. Now, when we see abstracts, we see a lot of typical deficiencies. And so here's a little cheat sheet of deficiencies you can look for. The study population maybe is poorly defined. So you don't say who's being studied. We don't know if it's an office-based. We don't know if it's pediatric. We don't know if they're emergency room visitors. So we don't really know who the work is being done on. The sample size or test period is inadequate to allow a robust analysis. You've done the intervention for 3 days and you've decided, well, that's good enough, and you only have 3 days worth of data, and that's going to definitely be counted as deficiency. The sampling method is inadequately described. So you may have done all the right things. You may have picked a random population. It may be every 5th person presenting at the emergency room, or 500 consecutive patients with abdominal pain showing up in a primary care office. But if you haven't described that well, we're going to have to speculate on what you've done, and that's going to cost you points. The intervention isn't sufficiently defined. We aren't even clear. 2 reviewers can't even be clear about what it is you actually did. The measure you're using is inadequately described, so we're not able to judge whether it's a good measure or not. Statistical treatment was not done sufficiently well to characterize the results, or the results cannot be really attributed clear to the intervention that you've chosen. There's too many other explanations. These have come from actual abstracts that have been submitted. These are actual weaknesses that we've seen in the past, and they're all reflected in the scoring mechanism that we showed you. So let me summarize and just say it's important to be succinct. There is a 750-word maximum across the 4 categories. That's not 750 words in each section. You really need to use the scoring logic to guide your write-up. And I should have put a link in here, but it is available on the ICE site. And if we update the ICE website or update the scoring logic, we will post the revised logic. So whatever is on the website, ice-lab.org, is the current logic being used by the evaluators. And before you save that submission, make sure you go back to the list of the common deficiencies on the previous slide and check your work against that, because that's where we see most of the weaknesses coming through. Good luck, and we look forward to evaluating your abstract and adding it to the body of knowledge for the profession.